What is uterine fibroid embolization and when is it needed?
In fibroid is that there is the uterine muscle. A few of these cells are increasing in number and size. These fibroids, since as the muscles are having a disordered growth, similarly, the blood vessels inside these fibroids are also having disordered growth, and that is another reason for increased bleeding during menstruation. And that is why you need to treat fibroids. And uterine fibroid embolization, what we do is we block the blood supply to these fibroids using particles as small as sand particles. And this leads to when we inject these particles into the uterine fibroids, they block the blood vessels to these fibroids, and then as a result, we dig a grave for the fibroid within the uterus itself, and it starts shrinking in size.
Why is uterine fibroid embolization better than conventional modality of management like surgery?
Compared to these aggressive modalities of surgery where you need to undergo a general anesthesia, get operated, and probably even lose your entire uterus, uterine fibroid embolization, what it does is through a small axis, we get inside the blood vessels and we block it. And all this is done. It can be done as a daycare procedure or an OPD basis, and at the most maybe 1 or 2 days admission, if at all the patient is having significant pain post procedure. And and the patient has no scars, nothing, and in 2 days the patient is absolutely fine and can go about their work. Actually, they can even resume activity on the same day after the procedure. Whereas in surgical procedures, they have to undergo bed rest, they need to recuperate. There is no significant recovery period that they need to undergo.
What is your clinical experience on the results and present literature evidence of this procedure?
We have had good results with uterine fibroid embolizations, and even literature says that uterine fibroid embolization is as good as myomectomies and hysterectomies as far as the symptom relief is concerned. And in addition, you avoid the complications of surgery or the complications, side effects of medication.
What is radial approach and how is it beneficial for the patient?
So basically, radial approach is an access through the radial artery, which is an artery which is seen here. Through this small artery, we can enter the blood vessel, and once we are inside the blood vessel, we can reach anywhere anywhere in the body that has a blood vessel. So through this access, we go in, we do the procedure uterine fibroid embolization, and the patient is ambulant immediately after the procedure. They can move around, they can even be discharged on the same day evening. So with radial approach, it becomes very comfortable for the patient and even for the doctors, because we don't have to worry about the chances of any complication happening with a radial access is very low.
What is your message to the general physicians about managing the patients in their OPD settings who are presenting post-procedure?
Only thing is we need to see whether the patient's pain is responding to the medications or not. Usually the pain persists for 2 to 3 days, which can be managed with simple analgesics. Symptom relief for the patients. So let's say the main complaint of the patient was pain. Then we have to assess what is the current status of the pain or the symptoms, fibroids to shrink, and we have to wait for at least 6 months to get and assess the final results of uterine fibroid.